Hello, family. It's always good to speak to you. My name is M. Moody. I'm a medical imaging and diagnostic radiographer with a special interest in ultrasound. And this morning, I would like to speak to us about an interesting topic about the role of ultrasound in screening in erectile dysfunction disease. So I will just want us to talk about why we do ultrasound in male who have issues with the erection. Erectile dysfunction is a condition in male where male have a problem with maintaining the erection. So one of the major diagnostic tool that we have around is ultrasound scanning. And the reason why we do this, we just want to look at an ultrasound of the penis, just to look at the blood flow in the blood vessels that supplies the penis. So we look at the arteries and the veins that supplies the penile shaft. So when you look at the blood flow in these veins, we want to rule out one, there's something called arterial insufficiency, just to make sure that the blood flow that is coming to your penis during an erection is sufficient. The next thing we want to look at is we want to look at the veins to rule out something in medicine we call venous leakage. And venous leakage is where we have the valves. The veins are made in a way that we have valve that close up the blood when it's flowing, so that will prevent it from backflowing, or will prevent something called backflow of the blood. So when you're doing a penile Doppler, we look at those veins to make sure that the valves are working well. And there's a condition called a venous valvular incompetence. We just want to rule it out, that the valves are working well. The valves might be destroyed because either you had a problem, either you had a trauma, either you had a disease, either you had a clot that you suffered, but maybe you did not know. So it caused the valves it destroyed the valves. So it damaged the valves, so the valves cannot work well. So if this happens, then you will have a problem in maintaining an erection. So we also want to look at the muscles that forms the penis. We want to just rule out something called penile fracture. I know people don't think that you can have a penile fracture or a fracture on the penis, but yes, it's true that a male will have a penile fracture, and sometimes you will fracture a penis and yet you don't know. So it will heal, but yet it will cause a scar on the penile shaft, and these might bring problems when you're having an erection. The next thing we want to look at the scrotum. We want to look at the blood flow in there's a structure in the scrotum called papilliform venous plexus. We want also to make sure that the blood flow in these veins are okay, that there's no backflow also, that the valves in these veins that form the papilliform venous plexus are working well, that they're not forming, or they're not having blood to backflow in the veins. So we just want to rule out something called varicocele, so that if there's varicocele, if there's a problem in the valves that supplies the papilliform venous plexus, then we can always have a solution. Then we can always communicate it with the urology team, so that at least we can have a solution to the problem that you're having. So men outside there, I know it has been known in the society that always the issues of ladies are handled, but I want to assure you that even if you are a man and you have a problem and you have an issue, kindly come forth, visit your healthcare provider, so that at least some of these problems can be detected, and can be solved, and there's a solution. And as I've always said, God has given us this information and these technologies so that we can help each other, we can help someone outside there. So if you have this problem, or if you know someone who's having this problem, kindly encourage them to visit a hospital, encourage them to visit their healthcare providers, so that at least some of these problems can be sorted. So once we share this information outside there, it's always good to share information. I've always said that once we share the information, once we share the information, we help the information grow. We help people outside there to know what some of these things are outside here, to be why some of these things we do them, why we do some of these examinations that we do in the hospitals, because maybe someone might not be knowing if something like this cannot be done. But kindly share the information, so that the information can be passed to everyone in the community. because actually my desire has always been that we help each other so that at least we can have a better society, a better place, a better society. We can improve the life of someone, we can improve the life of I can improve the life of my brother, I can improve the life of my sister, so that at least we can have just a better society, a better society where we can coexist. So kindly thank you. I've always said, I've always appreciated your tuning in. I've always appreciated those who have subscribed to my YouTube channel. And even as you get this information, kindly share so that at least other people can listen to what you are listening to. And let us just keep on sharing the information, because you have been given this information so that we can give it out, so that it can be of help to someone, so that it can be helpful to some people outside there. So thank you very much for joining me, and thank you much for always subscribing to my YouTube channel. And actually, I look forward to speak to you next when I'm speaking to when I'm talking about my next topic. And actually, what I would like just to say is, have a great day ahead. Thank you very much.